The following podcast is brought to you by Kidney Stone Prevention Clinic of Orlando. Dr. Paul, welcome back. So good to see you again, Dr. Paul. Could you tell us why you started your business and what is it?
Yeah, so business that we have is kidney stone prevention. And so if patients are actively passing a kidney stone, that's for urology to manage. But once that's been treated, if they've had multiple stones, then I come in and work them up and figure out, why do you keep making stones? Let's figure this out, and let's get you on a good treatment regimen that's going to keep you from making stones in the future.
Does this type of service, medical treatment, is this a little different than the standard treatment that someone can have?
I don't know if it's necessarily different, but I tend to be very thorough. So, again, you evaluate each individual patient and find their specific risk factors. And I think what happens is a lot of patients get sort of generic recommendations that aren't going to help with their specific problem. So I've had patients where they'll be on treatment with something and they'll say, should I take more of this? And I'll be like, no, because that's not your problem. That's not going to scratch your itch while you're making stones. Here's why you're making stones, and this is what we're going to do differently. And then again, it's very objective. So we'll measure it again, and I'll show them, here's what it was before you started this treatment that I gave you, and now here's what it is after. And they can actually visualize quantitatively what the difference is. And if you get them to goal, they will stop making stones. So it's a very rewarding intervention.
That's amazing. It sounds like a very customized, very singular onto you. This is you. This isn't general thought or trends. I mean, we're gonna drill down to you and exactly why you're making them. So that sounds amazing, Dr. Paul. Definitely a great service. And Dr. Paul, right, on the last podcast, we discussed beverages that kidney stone patients should avoid. Off the top of your head, let's do a quick review. What should one avoid drinking if you are producing stones or you don't want it to?
Yeah, so the beverages to avoid, one is grapefruit juice. For whatever reason, we don't quite know exactly why that is. And the second is high fructose corn syrup containing beverages, different sodas or juice drinks that people will take in, flavored juice drinks that contain that with regular sugar.
Yes, even we're talking about Gatorade, right? That's it's pretty good if you're young and you're sweating up a storm. But if you're making stones, you should probably avoid Gatorade.
Well, the Gatorade's got glucose in it, which isn't fructose, but it does have sodium in it, and that's something that can be a problem if you have too much sodium in your diet, and then it goes into your urine. It'll increase the amount of calcium that goes into the urine and increase risk for stones.
Okay. Wow. All right. So that's what you can't drink. We're also told, and it goes back and forth with all these studies. Should you avoid milk and dairy products?
Yeah, so that is a huge one, because for a long time, that was the advice that patients got. You're producing calcium stones in your urine. You need to decrease the amount of dairy and calcium that you're taking in your diet. But when that was actually looked at in a formal study, it was determined that the patients with lower calcium in their diet actually made more stones. So the average person takes in around 1,200 milligrams to 1,500 milligrams of calcium per day. And patients that had less than 800, the stone rate went up significantly.
That's a paradox.
It is. And so the thought was that it's the oxalate that's in the diet, that we get from legumes and leafy vegetables, et cetera, that now you don't have the calcium to bind it in the intestines. And so it gets absorbed into your body, and then to get rid of it, you have to filter it into your urine, and then you've got a whole skeleton full of calcium that you can use to make a stone with it. And So that's the rationale why we think that limiting calcium in the diet actually is something that's a risk factor for making stones, which doesn't seem, like I said, it's counterintuitive.
Yeah, it definitely seems like the paradox seesaw back and forth. And yeah, I guess it would really take working with someone like you to find out, yeah, hey, maybe it's a good idea. Maybe you want to have some cheese with meal or something, but maybe you don't. Can you tell us about a patient who was making stones and they were thinking about avoiding milk and dairy or taking it. Can you give us like a case scenario? That would be great.
Yeah. Well, I mean, and so what you'll see sometimes is, excuse me, you have patients that have lactose intolerance, so they can't
Mm.
take dairy, and they have high oxalate in the urine. So the one thing you'll do is try to limit the high oxalate content foods. We review that with patients, but then also if they can take dairy, we have them take dairy if they can. And so I had a patient just the other day. That was my recommendation, was if you can take dairies, and the person said, yeah, absolutely. I said, well, then you probably should take a little bit with each meal, because your urine oxalate's high, and that should actually help decrease the amount of oxalate in your urine and lower your risk for stones.
So yeah, so for someone who has a thick of a skull as me, it's kind of like it's counterintuitive, like you said, right? So if I used to think, boy, I better lay off the dairy because I don't want to have too much calcium on blood. So the possibility of making stones. But what you're saying though is if you are your body will actually put the calcium in the urine if you don't have enough calcium coming in. Did I get that right?
Yeah. So the calcium is less of an important factor for the stone production than oxalate, actually.
Okay.
But it's certainly a factor. So getting one thing, a couple of things I want to add here, Will, is one beverage that we talked about last time was tea. And again, there's a study that shows if patients take in more than 5 cups of tea per day, they have lower stone risk. But the caveat there is for patients that have high urine oxalate, they might want to avoid black tea, because black tea does have quite a bit of oxalate. So I want to throw that caveat in there. But if you don't have a problem, and so that's why I'll see patients and they'll say, do I need to oxalate restrict? And I love my spinach salad and I haven't had one for months. and I'll say, yeah, your urine oxalate is completely normal. You don't have to restrict the oxalate in your diet. That's not why you're making a stone. So then they actually feel relieved. They're like, wow, I've been really restricting my diet and I enjoy these things. And they're generally healthy things that you'd otherwise want to eat. So that's one that I see.
For the general population, one really doesn't have to restrict their calcium intake, correct?
Yeah, well, yes. And so, the caveat there, and it's not used very much nowadays, but previously when women were taking calcium supplements for osteoporosis prevention, that they actually had higher risk for stones. And the thought is they're taking it on an empty stomach. So they're getting this sort of calcium bolus. The natural thing to do is take it in with food, and then it gets absorbed in a more regulated fashion, and you don't get this spike in your blood, and then to spill over into your urine.
No, that's fantastic information. You're right. The absorption is key, and that's wow. That's really priceless information. Dr. Paul, what is one dietary recommendation that you have for kidney stone patients?
Look, so the general stone diet is adequate fluid, like we said last time, 2.5 liters per day, 80 ounces. Secondly, low salt. Third, again, probably for reasons that affect urine pH, not quite sure why, low animal protein. If you have more of a plant-based diet, that puts you at lower risk for stones. And then lastly, like I said, you don't want to restrict the calcium in your diet. You don't want a calcium load per se,
Okay.
but if you're taking in the normal amount of calcium, that's actually something that will reduce your risk for stone. So that's the general stone diet, and then we tailor it based on oxalate, other things.
Are there other things to consider for patients that have high amounts of calcium in their urine?
Well, yeah, that's a whole gamut of things. The one I want to talk about, because I've seen this more recently, are patients that take vitamin D, particularly high dose vitamin D. They'll have low blood levels of vitamin D, which when we're getting our blood checked for the vitamin D level, it's actually not vitamin D, it's 25 hydroxylated vitamin D. Which
What's
is an
the sorry?
intermediate.
What's the difference between vitamin D and 25 hydroxylated vitamin D?
So vitamin D gets either we make it uh, from when we go out in the sun, and there's a reaction in our skin that converts cholesterol to vitamin D, or we get it in the diet. And there's different types of vitamin D, D2, D3. So that's the places that we get D. But a lot of patients are deficient in vitamin D. But again, the screening that you do is 25 hydroxy vitamin D. But the metabolically active form, this is a lot of chemistry,
Right.
is 125 dihydroxy vitamin D. That's the active form. And that's actually the one that makes you increase calcium in absorption from the intestines. So what I'll see is patients that have a low vitamin D, they'll start this high dose vitamin D, and they wind up making stones. I'll ask them, I'll say, this will be somebody in their 50s. And I'll say, well, how long have you been making kidney stones? They'll say about 2.5 years. I go, you didn't make any stones before 2.5 years ago? And they said, no, I lived my whole life otherwise. And this is just a recent event, phenomenon. And I'll look at their med list and I'll say, how long have you been taking the vitamin D? And they'll say, about 3 years. I'll be like, that's, I think, why you're doing it. And so that's one thing I discuss with them about how they can safely take vitamin D to raise the level while not increasing their risk for making stones. So that's another thing that I review with patients that have that particular dilemma.
Oh man, this is really good information. Just for the people, vitamin D is in the news lately, and we're hearing information. Vitamin D pills are okay. I live in the north, Dr. Paul. I know you live in the sunny Florida. So if you can, is it just for your patients or anybody else? I mean, do you advise them, hey, try to absorb it through your skin a little bit, without, getting the risk of skin cancer, versus taking a vitamin D supplement or medication, because a lot of people, I guess, can't go out in the sun either, or many times a year, even if they live in the sunny South, they might have a skin disease or whatever that prevents them from being out in the sun. So, like I said, we're hearing all this information. What would you prescribe to a kidney patient for vitamin D issues?
Well, to get back to your point, if you don't have like history of skin cancer where you need to limit your sun exposure, that's actually a safe way to get
Best way to
vitamin
do it.
D. There's old studies that showed lifeguards had vitamin D levels from natural production of over 100, and no untoward effects at all with respect to calcium or phosphorus or anything else in their metabolism. So that seems to be a safe way to do it, and probably because it's slow. It's not something that's going to be a dramatic change, and that's the difference when people take these large doses and they get this, like I said, spike of vitamin D, and then your body's trying to figure out, how do I metabolize all this? And what'll happen is, especially if patients are heavy, the vitamin D goes into the fat tissue, the adipose cells, and it stays in there and gets degraded, and so it doesn't change their blood level, but it will increase the 125 active form, which nobody checks except for me. And I'll say, that's why you made stones. Your 125 vitamin D level's high. And they'll be like shocked because they'll say, my doctor told me my vitamin D level is low. And I said, no, that's the 25 hydroxy vitamin D, but your 125 is high. So you've got a a dichotomy there where one is low and the other is high.
Folks, you got to see Dr. Paul. If you have any problems at all with making stones, contact Dr. Paul. Dr. Paul, this has been an awesome podcast. Thank you so much for joining us, and we look forward to seeing you on the next one.
Thank you, Dr. Paul, for joining us. Once again, you can reach Dr. Paul with any questions at www.kspfla.com or at 239-221-1281, the Kidney Stone Prevention Clinic of Orlando. Until next time, folks.